Hi, I'm Dr. Jolene Brighten, and I wanted to chat with you today about acne. Acne is a really common skin condition that affects a lot of people, and in my clinic, I see it quite often. People are trying everything topical. They're also doing a lot of internal work with pharmaceuticals, and they're not getting lasting relief. So I want to give you some tips today of how I work to help people eliminate their acne altogether. So first place we have to start is with your gut. And I don't think that that's a huge surprise to some people. We know that our gut is a place where our immune system really lies. And if you're having gut dysbiosis, so overgrowth of bacteria, or you're eating foods that are inflammatory, you're going to get inflammation. That inflammation is going to cause your skin to flare. So taking a look at the gut, the first place I have patients go is in shifting their diet. So I like to use what's called an anti-inflammatory diet. What that looks like is getting the grains down. So reducing the amount of grains that you're taking in every day. Those are very inflammatory and they can drive acne. Gluten in particular, I ask people to remove gluten and dairy for 6 weeks to see does that help their skin improve. I also recommend increasing your servings of fruits and vegetables, especially dark leafy green vegetables, orange pigmented vegetables. Those with higher carotenoids in them actually give the appearance of more youthful and attractive skin. There's been research on this. So I recommend increasing the vegetables. As far as fruits go, it's like 0 to 1 servings a day. I don't want to see people consuming a lot of sugar. So that's the other part of the diet, is bringing down the sugar, which is also very inflammatory and can feed gut bacteria and also yeast. So if you start doing some of this dietary stuff and you don't see changes, sometimes we have to look a little bit deeper and see, is there some kind of overgrowth of bacteria or yeast in the gut? So you might have a condition called intestinal permeability or leaky gut. There could be potential of bacteria, parasite, or even yeast, and that you really need to work with a qualified healthcare practitioner to understand, is that what's going on for you? However, you can employ these dietary changes and give it about 6 weeks. So other things that you can start doing: remove all conventional meat from your diet. So conventional meat, it's going to be grain-fed, it's going to be given antibiotics, and a lot of times they're also using hormones. That can influence your hormones and disrupt your gut health overall. You can also start changing your fats over. So I recommend all processed food, hydrogenated fats be eliminated from the diet. If you want to improve your skin, you need to feed it with good oils. So things that are high in omega-3s. We're not only talking about cold water fish here, but you can also integrate nuts. Some people don't do well with nuts. So if you notice you start eating nuts and your skin flares, that's a sign that it's not working well for you. I also recommend that people start using things like coconut oil. You can also take really good quality olive oil and start incorporating that maybe into salads, unheated. I don't like people cooking at high heat with their olive oil. So you start shifting the fats, start shifting the meat. Change the proportion of grains to vegetables, so less grains, more vegetables, and then try fermented foods. Kombucha, sauerkraut, kimchi, incorporating those into your diet, or maybe taking a really good probiotic to help your gut flora and to influence your immune system in a positive way. So some people, they don't feel good when they eat fermented foods, and they don't feel good when they take a probiotic. If that's the case for you, it's definitely a sign that you need to have your gut investigated. Make sure there's nothing going on, that you're not feeding bacteria or yeast that shouldn't be there, because some people will actually feel gas and bloating when they have that, and that's a sign that that's not right for you. Another issue that could be going on is adequate vitamin A. So if you're not absorbing your nutrients well, if you're not eating lots of really quality vegetables and quality fats, then you're not going to be getting adequate vitamin A in. And vitamin A is a big player in skin health and also in immune health. So that's another area where I see people improve in their skin symptoms. Now, the last thing I want to talk to you about is liver health. This is usually overlooked. And when I'm talking about liver health, I'm not talking about having a chronic disease of your liver, but your liver is processing all of your toxins. And the reality is that in this world, our liver is pretty bogged down. I mean, you can walk through a department store and your poor liver gets hit with so many perfumes. It's got to process all of those chemicals out. So definitely make sure that you go to the environmentalworkinggroup.org. I want you to check out their Skin Deep profile. Make sure you're not putting anything on your skin that is pro-estrogen, so like parabens. You want to make sure that you have the highest quality skincare products coming in. Also want to make sure that you're keeping your environment clean. So in your home, not having extra cleaners in your house. I mean, you can use things really simple like vinegar, baking soda to clean, and that's not going to be a burden on your liver. And then the other thing to look at is the Dirty Dozen and the Clean 15 that they have on there. I recommend that people choose organic foods as much as possible. That's really what's best for your liver, best for your body overall, and going to keep your gut healthy and happy. But sometimes you can't always choose organic. So knowing when you can break that rule, the Environmental Working Group has a great resource for that. And to go one step further in supporting your liver, I recommend that people consume foods like burdock root. So burdock root is also known as gobo root. It just looks kind of like a carrot, except it's brown on the outside. You take off the outer skin, chop that up. You can put it into soup or saute it. You want to cook it. It really doesn't taste like much, and it's very powerful at helping the liver move, so you don't need to eat a lot of it. I also recommend eating things like beets, getting those dark leafy green vegetables in. And one more step that I like patients to take if they notice they're having breakouts, maybe your breakouts are coming a certain time of the month, is they utilize a castor oil pack. So you can actually soak a flannel cloth and do a whole castor oil pack, but what I have a lot of patients do, because this is just easier for them, is put a small amount of castor oil in your hand, about a quarter size, and you're going to massage the belly in a clockwise direction. Get on the upper right side of your body, that's where your liver is, and you'll massage that in at night. Put a white t-shirt on and go to bed. The reason for the white t-shirt is it's going to stain your clothes. So firstly, we don't want to ruin a good shirt, but also we don't want to be pulling any dyes into our skin. What the castor oil does is it's a counter irritant. It's going to increase circulation to your liver. So we're talking about the immune system and the blood flow of the digestive tract overall, getting that moving so you can process some of these things out. I recommend castor oil packs be done 4 nights in a row weekly. If you're a woman and you know, hey, about 5 days before my period, I have a breakout, start the castor oil packs 5 days before, start increasing your liver healthy food and the anti-inflammatory diet and the gut repair aspect. That really needs to be an ongoing process. But if you take these steps, you should see a reduction in your acne and over time, a complete elimination. So I hope this has been helpful for you. This won't be the last time we're talking about skin, so definitely stay tuned for more information on how you can take care of your skin and your gut health.